Good afternoon, everyone. Thank you for joining our Dementia-Friendly Nevada Distinguished Speaker Series today. It is wonderful to see many familiar names and faces and also to see some new ones here. For anyone I haven't had the opportunity to meet, my name is Casey Venturini. I have the privilege of serving as community convener for Dementia-Friendly Nevada in my role with the DEAR program, the Dementia Engagement Education and Research Program based in the School of Public Health at the University of Nevada, Reno. And the DEAR program serves as the institutional home base for Dementia-Friendly Nevada. I am joined here by my dear colleagues, Bradlyn Weissert, who is the DEAR Program's Community Programs and Education Coordinator, and then Dr. Jennifer Carson, who's the director of the DEAR Program. We form the Dementia Friendly Nevada support team. But truly, as anyone who has connected with Dementia Friendly Nevada before, the true lifeblood of Dementia Friendly Nevada really lies in our network of community groups. So Dementia Friendly Nevada has 9 community groups across the state that are each working at the local level to work towards becoming more respectful, educated, supportive, and inclusive of people living with dementia and care partners, and really taking local action toward that goal. And each one of those local dementia-friendly Nevada community groups is led by committed local co-facilitators, really dedicated volunteers who are spearheading their local efforts. I see some of our local co-facilitators on the call today. Thank you to those co-facilitators, and thank you to all of our members, anyone who has joined a dementia-friendly Nevada community group meeting in the past. Thank you for your capacity, for your ideas, and for joining us in this shared mission. To anyone who is joining from outside of the state of Nevada, you are an honorary member of the Silver State today. Thank you for being here. These Dementia-Friendly Nevada Distinguished Speaker Series sessions are really designed to offer useful information, resources, best practices that can help inform the work not just of Dementia-Friendly Nevada community groups, but of anyone engaged in the work of supporting the well-being of people living with dementia and care partners anywhere. So please know that this session will be just as useful to you if you're outside of Nevada as inside. A couple of housekeeping things before I introduce our wonderful distinguished speaker series, distinguished speakers for today. We will be recording this session and posting it on the Dementia Friendly Nevada website within the next week. So you will have access not just to the full recording of today's session, but also to the presentation slides available online, and we will send out a notice when those are posted. So while I, of course, encourage you to take notes, you can always know that you can come back and watch at a later date. You can also share with anyone who isn't here, but you think would really benefit from the information and resources that we'll learn about today. I know that our presenters are going to have a Q&A portion at the end of today's session, so please do think about any questions that you would like to ask our speakers, any ideas you'd like to share, stories you'd like to add to the conversation. We will have a portion at the end for that. If you would like to use the chat box as an opportunity to keep track of those questions, please feel free to do so. I will make sure to keep your question and jot it down, and we can pose it back to our presenters at the end. That way you don't have to feel like you have to remember it until the end of the presentation. Otherwise, we do ask if you wouldn't mind keeping yourself on mute throughout the session today. That really helps to make sure that we minimize distractions. But we always encourage you to turn your camera on if you're able to do so. We can see your lovely faces. That is all I have for you. It is the last thing I will say before I get in the way of you and our wonderful speakers today. So it is my pleasure and honor to introduce our distinguished speakers, Bill Benson, Megan Dickin, and Marvina Chavez from the International Association for Indigenous Aging to take us through a presentation about resources to support dementia-friendly communities. So without further ado, I will hand it over to Bill to get us started. Bill, Megan, and Marvina, thank you so much for being with us today.
Thank you, Casey. Thank you for inviting us to be your distinguished speakers today. That is a real honor. So we are thrilled by that. I want to say hi to Jennifer and Bradlin and the rest of your team and all of your members of the Dementia-Friendly Nevada group, and even as far away as New Zealand, I saw in the chat. I'm Bill Benson, and I am the president and co-founder of the International Association for Indigenous Aging, or IA squared, as we refer to it. If I could get the first slide up. That's a slightly younger version of me on the left. I do need to update my photo, but not too much younger. But the reason we have this slide in here is I want you to meet my co-founder, who can no longer be with us in person because he passed away in February, and that's Dave Baldridge. Dave was an enrolled member of the Cherokee Nation, and together we founded IA Squared in 2002. So 24 years ago, he leaves a tremendous legacy and a big hole for us that will be impossible to fill. But part of his legacy is to continue the work that he had the vision to get us started on. Dave had previously been the executive director of the National Indian Council on Aging, based in Albuquerque, New Mexico, for about a dozen years. And when he stepped down, we decided to form IA Squared. And I think we've been going strong ever since. We have several constituencies. Broadly speaking, our constituency is to help do what we can to support and improve the lives of Indigenous elders, American Indian, Alaska Native, and in some cases, Native Hawaiian elders. And we do that with other constituencies. We aren't able to reach individual elders directly as a national organization very often. So our purpose really is to help support tribes. There's 575 federally recognized tribes in the country and a large number of state recognized tribes. Our mission really is to help those tribes provide services and support to the elders within their tribal communities, hopefully using some of the strategies, approaches, and particularly the resources that we develop in several program areas. Another constituency are American Indian, Alaska Native people, regardless of where they live. You probably know that a great preponderance of American Indians and Alaska Natives no longer live on tribal lands. They live everywhere. I live personally just outside of Baltimore, and we have a Native population in the city of Baltimore and in Maryland. Maryland has a Maryland State Commission on Indian Affairs. So wherever you are located, there's an Indigenous person somewhere around you. And so we want to help people who serve that population in cities and suburban communities know how to better reach, how to better respond to, how to appropriately serve their constituents who may be Native American. And another constituency along those lines are individuals who have programs and services that might reach Indigenous people, like state agencies, state public health agencies, state units on aging, local area agencies on aging, local health departments, anybody who has a responsibility to serve those that live within their service area, within their jurisdiction. If it includes Indigenous people, we're here to try to help them do that better. So that's our constituencies. Let me show you the rest of our team. We are a very small shop, a mighty shop, but a small shop. Here you see Megan Dickin and Marvina, who are going to carry the bulk of this presentation today. Thank goodness. I'll just be a listener for the most part. They form our brain health team. You see it listed as HBI staff. HBI stands for the Healthy Brain Initiative, and you'll hear more about that from Marvina and Megan in a moment. Other staff members that make up our Elder Justice team, Peggy Jo Archer, Danelle Woodman, and Emma Lynch. Not shown here is Kendra Keene, who supports all of our programs, does a lot of our policy work, a lot of our administrative work. In addition to the staff that you've just seen, and this you're looking at our total staff quite candidly, we have a extraordinary team of consultants and subject matter experts who work with us either on an ongoing basis or from time to time. An example of that is Mike Splain, that some of you may know. Many, many years with the National Alzheimer's Association, and now a very valued consultant to us. Another one, I'll just as an example, Margaret Carson, who is the Director of Adult Protective Services for the Muckleshoot tribe up in Washington State. We could not do our work without our kind of extended family, if you will. So, and we do think of them as family. Very briefly, I'm going to say a little bit about our primary areas of focus. You're going to hear about one of them, and that's our work in brain health, and that is a very substantial portion of what we do. And Marvina and Megan will take you through our work in brain health. Another area is in what we call elder justice. And that is to a large extent really focused on helping tribal communities address elder abuse to the extent that it is a problem in their communities, to help them figure out how to recognize it and what to do about it. More recently, that has evolved into helping tribes to develop their own adult protective service programs, which we are now doing. The Administration for Community Living has begun a very small grant program for tribes to enable them to create adult protective service programs that are tribally based, and we are helping that to unfold. We also work with state adult protective service programs to help them better serve the Indigenous population within their area. Those are our two primary areas of focus. We have addressed a number of other issues, for example, and you'll hear a bit about it today, long-term services and supports. We had, I think, a very exciting couple of projects related to helping tribes to promote and support the delivery of vaccinations, particularly for COVID, flu, and even monkeypox. Unfortunately, because of political changes in our nation, the funding for those programs has stopped, but we still believe in the mission, and if the opportunity arises, we will return to that work if we get the opportunity. And then finally, the last thing I'll mention here is our policy work. We are committed to representing issues that affect Indigenous elders across the country and those who serve them at the national level with the Congress, with the executive branch, as best we can. That means at times testifying before Congress, helping to promote legislation where we can, work with the executive branch around policies that affect Native Americans generally, but certainly elders. So we try to do as much as we can in the policy advocacy world. And the reason we do that is we like doing that. That's a good reason. We're good at it. It's another. But there are very few national voices that are engaged in policy advocacy around Indigenous elders. Thank goodness there's the National Indian Council on Aging, there's the National Indian Health Board, but beyond that, there aren't a lot. And so we think it's just an area that we have to work in, even though no one funds us to do that work. We just believe in it, so we do it. Sort of a backbone for us, if you will, in our brain health work, although our work predates this, and that is the Roadmap for American Indian and Alaska Native Peoples, building a culturally grounded roadmap for brain health in tribal communities. The Centers for Disease Control and Prevention, or the CDC as we call it, in partnership with the Alzheimer's Association, began many years ago in 2005, what we call the Healthy Brain Initiative. And that quickly evolved into a series of roadmaps on how to engage and take action related to brain health from a public health perspective. I think there's now been, I believe, 4 separate roadmaps produced over time, each for a period of 4 or 5 years. Several years ago, the decision was made by our organization, IA Squared, in partnership with CDC and the Alzheimer's Association, to create the first roadmap. It was called the Roadmap for Indian Country. And out of that, we focused explicitly on how do we more effectively serve and motivate and support tribal communities in particular in addressing brain health among their tribal members and in their tribal communities. And the roadmap is really a series of actions that communities and others, like state health departments, for example, can take from a public health perspective to promote action around brain health in a number of different dimensions, excuse me. We were very involved in the original roadmap for Indian country, working with the Alzheimer's Association as a consultant to them before we were actually funded to do our brain health work. And then once we began doing our brain health work, funded first by the Association for State and Territorial Health Officials, and now from the CDC through the Healthy Brain Initiative, we worked very closely with the Alzheimer's Association and the CDC to produce the current roadmap, the one you see pictured here, the roadmap for American Indian and Alaska Native peoples. We're very proud of this document. We think it is a really meaningful guide that tribes and others who want to serve this population can use to help guide them through a public health lens on what we can do to address Alzheimer's among American Indian and Alaska Native peoples. And you'll see we try to use this as a pillar, if you will, or a foundation for all the work that we do under the Healthy Brain Initiative and in about brain health in general. And so I think that'll help you to understand what we're doing by knowing that we have this as our foundation. I think there's a lot to the roadmap. We could spend our whole 90 minutes on it. We won't do that here. So with that, I will now officially turn it over to Marvina and Megan.
Hi, good afternoon, everyone. My name is Marvina Chavez, and I am an enrolled member of the Navajo Nation. And I am currently based out of Albuquerque, Rio Rancho, New Mexico. And I am happy to be here. So one of the things that we want to talk about today is really to be able to put some questions and some thinking into our presentation and how our end users will be able to receive this information. So some of the things that we, ask our participants to really kind of look at is, what could these resources be and what could they look like within your community? What are your current programs and events and initiatives that could strengthen some of the work you're doing in your community, and who are your existing partners and champions and within your own communities, and who can bring some stability, who can bring some ideas to the table to expand your reach and impact. So as we move through this presentation, kind of have some ideas, opportunities for, what are your next steps to be able to advance some of the work in, especially in brain health, and also related diseases in dementia. So one of the things that really makes I² very unique is that, from a national perspective, we are really mindful of the community-informed publication and resources that we create. Our publications are designed by Native communities and they're created for our Native communities. Every resource is developed in partnerships with our tribal communities and Alaska Natives, and it is a community-driven processes that we use methods like listening sessions, talking circles, community surveys, and community feedback, utilizing our resources and partners through national advisory boards, tribal elders, and Title VI directors. And right now, we are making some great opportunities where our resources are now in 28 plus states. So that is a real big accomplishment for I² to be able to have our publications being in those many areas, especially in our tribal communities. So with brain health, we have gone back and looked at how we can be able to kind of structure our our resources for our users and community, our tribal communities, to be able to engage on how and when to utilize our resources. So we have identified like 6 categories that we want to be able to start structuring out and provide awareness. Brain health and healthy aging starts with prevention, understanding dementia and early detection, caregiving and living well with dementia, community education and outreach, tribal leadership, policy and community planning, and being culturally responsive and best practices. And this is all our approach to be able to have some sustainability of our resources, and how do we build out and support these resources in each tribal community that we serve.
Okay, thank you, Marvina. I'm Megan Dickin, and I'm an enrolled member of the United Homa Nation of Louisiana. And I'm one of the Tribal Public Health and Aging Senior Associates here at IA Squared. And so I'm going to be talking about our resources that relate to that first category that Marvina mentioned about prevention, focusing on brain health and healthy aging. So one of our first resources that I'd like to highlight is the 4M's of age-friendly care. So if you've heard of the 4M's of age-friendly care, it's a framework made by the Institute for Health Improvement and the John H. Hartford Foundation. Well, we worked with the Yale GWEP program, which is a geriatric workforce enhancement program. And they have all GWEPs, each state has a GWEP. And part of their focus is to help build capacity for serving elders, not only Native, but just with the aging population, and creating more age-friendly health systems. So part of the GWEP's job is to also address and help Native populations and communities. So they approached us to help adapt the original 4M's framework to be a more culturally grounded approach that's more suitable for American Indian and Alaska Native communities. So what we did is we took, if you look up the 4M's of age-friendly care, it's kind of a circle with 4 concentric circles going around the center circle. But we decided to create that into a tree that represents and honors the Indigenous values, traditions, family, and community in a way that is more nature-focused and more resonates more with Native populations. And each M, instead of a circle, we created as the branches, because that all, and what matters most as the center, because that's the main thing, and then everything branches off of that. We also included the roots, because those are all things that are important and what matter to Indigenous people, just kind of naturally. And so that is being able to be rooted in those things, while the trunk of what matters most is more of an individual, what matters to the individual. So this allows care providers to help center care around what matters to what that elder wants to keep doing in their life, and how the healthcare system and practices can empower that person to continue doing those things that are important. So this promotes a person-centered, culturally responsive, and strengths-based approach to their care. Another resource that we have is the Healthy Heart, Healthy Brain flyer. This is just an 8.5 by 11 flyer. And these are quick reference for community members to learn about the connection between heart and brain health. So this has updated statistics. It's written in plain language. So all our resources are done in plain language to allow for ease of reading and also ease of translation, especially if it's needed to be interpreted or translated into an Indigenous language that many of our elders still speak today. There are different design options, and it's good for print or digital distribution, and it can be used for multimedia and community outreach. So we really like to share this one, and this one is good to be integrated into other programs that you may already be doing about heart health and overall general health. Whoops, sorry, I think I moved on too quickly. Now, one of our most popular resources are the Healthy Food, Healthy Brain BRAT cards. So these are just about the size of a third of a page, and front and back. And this series encourages healthy eating as part of a brain healthy lifestyle. So it combines practical nutrition guidance with culturally relevant recipes that communities can easily incorporate into daily life. So there's a series of 6 of these, and each one has a different recipe on the back from a different tribe from around the country. These are great to be used in senior nutrition programs, community events, and wellness activities to promote the connection between nutrition, heart health, and brain health. Another great resource we have is one that we've adapted. So some of our resources we create from scratch, like the rat cards, and all of our resources actually are created with input from the community. So we do listening sessions from people who we work with to make sure that it's culturally relevant, that it resonates, and it's appropriate before we launch anything. This one was not created from scratch. It was an adaptation of the Lancet risk factors for dementia, but we did do listening sessions to make sure the adaptation was appropriate, and as well as our advisory committee who gives us input on our adaptations and creation of resources. And so this infographic just kind of shows the modifiable risk factors that contribute to dementia and how they are kind of placed throughout the life cycle. And this is nice because it can be downloaded as a standalone document and used by itself, or be used as part of our Dementia Friends for American Indian and Alaska Native communities program. Like I said, the creation process included talking circles and listening sessions to make sure that it was appropriate. So if you've heard about our Dementia Friends program, we're going to talk about that a little bit later, but that's part of it as well.
So our next slide is understanding dementia and early signs, and it's our recognition category. So in this series, we look at the 10 signs of dementia, are supporting videos that help give a visual of what dementia looks like and what dementia is and what to look for, as well as myths, truths, and about memory loss, questions to ask your doctor, and symptom tracker. The 10 signs of thinking or memory changes that might be dementia. This flyer really addresses some of the things that you could start tracking, of some of the changes that might be linked to dementia in some of our elders. The content was co-created by the Brain Health Advisory Group based on contact and adaptations from, the Alzheimer's Association and University of Wyoming. And this series actually has an opportunity has several different design options as well. And these are, again, one-pagers, and they can actually complement some of the services that you do in your community, and they're convenient for handouts, for community fairs, events. They can be put in your clinics, urban health centers, as well as your Title VI senior programs to supplement, your health promotion, disease prevention programming. The Dementia 101 video is actually a supplemental video which gives a visual, and it's a video that basically explains, the differences between normal aging and what are some warning signs of dementia. And it provides an opportunity for caregivers to watch and learn and listen and start kind of identifying what their loved one is going through and some of the changes that are related to brain health. And it also gives an opportunity to utilize this again in different components of your programming, whether it's community outreach, senior centers, or health promotion events. Just giving additional resources to be able to know the signs of dementia and how you can help individuals and support families that are dealing with dementia, and for future planning as well. We also have a series of rat cards that address the myths and truths about memory loss. These are, gives an opportunity for community awareness and outreach on, what are some of the stigmas being able to provide, conversations about brain health. It gives, what is memory loss? What is the difference between, an elder having a medical change in their memory? Is it medically related, or is it, dealing with, some kind of more serious issue? It provides an accurate and easy to understand information about dementia, early signs of dementia, supports informed communications with family and caregivers. And this one was developed, for American Indians and Alaska Native communities, and it's culturally relevant to having those one-on-one conversations. The next one is, we have a brochure type of resource that can be utilized for anyone that, wants additional information or support on what kind of resources that you can ask your doctor. Preparing, it gives an opportunity to prepare for questions how to help individuals or families, and how, bridging meaningful conversations, and having an opportunity for caregivers or individuals who have a loved one dealing with a memory issues, to be able to make informed decisions. What kind of care do they need? What kind of resources do they need? It provides that opportunity to have that discussion for healthcare providers to be able to bring that additional support to address some of the concerns, especially about memory concerns. It gives caregivers an opportunity to have that open conversation, because sometimes it is hard to really formulate what questions do you ask? What are we supposed to be looking for? And this is kind of like a starting point for caregivers to be able to start identifying and asking any of their questions, and it kind of empowers them to be able to have that conversation and start building that relationship with medical providers, so that we can have a more responsive care for the individual that's dealing with the memory issues.
Marvina, if I can add, we developed this brochure, this trifold, in collaboration with a Choctaw medical student who is a med student at Yale Medical School. And she's in the enrolled member in the Choctaw Nation. And her supervisor is one of our board members, Dr. Doug Shenson. And so it was with actual medical provider input and oversight that we develop these questions. So it is really, relevant to be able to help a person ask the right questions to their doctor and bring the right questions to their doctor. So it was really nice to have their input and have it done with a Native student to have her cultural perspective added as well.
Thank you. So we also have the symptom tracker. The symptom tracker is actually a tool that really has been popular for a lot of family members to be able to have a document in front of them, to be able to log and kind of track what changes their loved one is going through. It helps record, behaviors, functioning over time, having, that information available to discuss with a medical provider on, times of episodes where an individual may be needing more support. It's easy to use tracking tool. It records when, where, and what happened, what is being observed. It helps identify a pattern of symptoms over time. And it has actually, it includes an example, for caregivers to be able to use this as an effective tool to try to be able to support them in some of the concerns and questions that they may have, and how do you address it. So it's a real-time live tracking tool to be able to start identifying some of those changes and behaviors that are happening with their loved one. And it really does support, having this kind of information to have an informed conversation with your healthcare providers. So our next series is, addressing caregivers and, living well with dementia. How do we provide support? We have a wandering toolkit, dementia bingo, and dementia one-on-one videos in our caregiving and long-term care services and supports. We have a wandering toolkit, and this toolkit has actually been in development for quite some time. And this is Megan's brain, the baby that she's been working on. But this is a project that was actually started with our director, Dave Baldridge. He was involved in search and rescue most of his life. And he created this toolkit to be able to support our community, tribal communities, be able to prepare and be responsive to situations where anyone, an elder, and anyone with a developmental disability that goes out and wanders off in their community. And this document actually helps the tribal communities be able to identify what resources do they have, what opportunities do they have to be able to start planning in advance, to be able to be responsive, to be able to get someone safely home. It's a person-centered approach. It involves improving communications with caregivers, families, tribal programs, first responders, and community members. But we also want to be able to help try to reduce any risk of injury for the elder, and make sure that they have a safe return. These resources are, can be culturally tailored for tribal communities. It's really a practical prevention and response strategy. And it also provides the opportunity for tribes to be able to customize it to fit for their community. But it is really important to have a tool like this because in some cases, our tribal law enforcement or county sheriff's offices may not be able to have the resources to be able to respond immediately as well. Megan, do you want to add anything to that?
No, thank you, Marvina. I appreciate that. I can take on the next slide. So thanks so much. Yeah, and I will just add, we are actually implementing this toolkit with a community in California currently. So we are in the process of, there's an actual workbook inside in which you fill out all the information that you need about your community, who's going to be involved, their phone numbers, etc. And then that helps you create your plan. So we're actually doing that with a tribe in California. And once we've helped them fill out their workbook, then we'll do an in-person mock search to help to walk through their plan and identify any gaps and make any improvements that are needed. So we're excited about that. And we welcome other tribes who are interested in doing that to reach out to us if they'd like to help with any kind of help creating and implementing their own plan for wandering. Okay, so our next resource is a real fun one. It's our Dementia Bingo. And so this Dementia Bingo serves as a resource to help enhance quality of life for individuals impacted by dementia. And it's designed to stimulate cognitive function, improve social interaction, and foster an atmosphere of joy and positivity. And it's been based on extensive research in the field of neurodegenerative disorders. Now, this is a fun and interactive experience, but it's not simply entertainment. It serves as a role. It serves a role to as intervention for both caregivers and patients, offering emotional respite and cognitive stimulation. Now, this is not. This can be done alone, or it can be used in conjunction. As you can see here, it says the Dementia 101 video that we talked about earlier. So what we typically do is we play the Dementia 101 video because it talks about all the things that are going to be, all the questions that are going to be asked in the Dementia Bingo game. And so then we play the video and then we play the game. And it's really great opportunity for conversation, learning, connection. It's really a nice way to open the conversation about dementia. And especially because with stigma and there's fear about talking about it. So it's a really nice way to integrate into events or even routines, and it can be adapted to fit a variety of settings and individual needs. And this is the, again, the Dementia 101 video that can be standalone or used in conjunction with that dementia bingo game. And so this explains the difference between normal aging and dementia. It highlights that dementia is not a normal part of aging. It encourages early recognition of memory changes and promotes conversations with healthcare providers and family members. And the link is down there on the bottom. So when you receive the slides, you can visit our homepage or our resources page and find all these things there for your use. And all our materials are free to download, and you can send them to a print shop if you'd like, or use them, virtually, but they're all available for your use. Okay, now this is a video that we created about building support for Native caregivers. And this video, you can visit the website here and watch it. It's about 9 minutes long, but what it really does is it touches on a program called the Savvy Caregiver in Indian Country. And this is a program that is delivered by two of our two of our partners who work with us, and the program helps give caregivers appreciate the scope and impact of their work, reduce the adverse effects of caregiving, increase their skills and knowledge, and adopt a strategic outlook on their work. It helps caregivers develop more effective strategies and decision making, improve their own self-care skills, improve the quality of life of the care recipients, and it increases involvement of families and other resources. Now, one thing to note about caregiving in Indian country is a lot of Native American people and Alaska Natives don't see themselves as caregivers because that's just part of the family structure. We just care for our elders, we care for our family members. And so, but this caregiving is intended for, and so, well, let me go back. So caregiving is often the term caregiving is often has a connotation of a paid caregiver or professional caregiver. But we are trying to also help people understand that as a family member, if you're caring for a loved one, you are also a caregiver. So helping them realize that these kind of videos and these kind of programs and these supports are available for them too, not just for professional or paid caregivers. And so this Savvy Caregiver can be for paid professional caregivers and for family caregivers. And so that's really important if you're working in Indigenous communities to kind of help recognize that for yourself. If you're talking with people who are caregivers, that they might not recognize that they're caregivers, and helping them identify that and know that these resources are available. So if you're interested in learning more about the Savvy Caregiver program, and this has been adapted specifically for Indian country because there is a Savvy Caregiver program for the general population, but this one has been adapted specifically for Indian country. And if you're interested in that, you can reach out to us for more information, and we can connect you with our partners who deliver that program. Another important support for caregivers and individuals living with dementia is long-term services and supports in Indian country. So we have some information about bridging culture and community. We developed a series of animated videos and companion fact sheets to help elders, caregivers, and service providers better understand Medicaid, home-based, and community-based services, or HCBS, waiver programs. And these resources help explain the services in easy to understand language, because they can be kind of complex. If you've ever tried to look into it, you've probably seen that there's a lot of complex government type language, and it encourages people to explore these type of options, to stay in the home and receive community-based services as an alternative, as we consider a better alternative potentially to having to go into an assisted living facility or something like that, or a nursing home. And it's designed for use by Title VI programs, tribal service elders, or tribal service providers, elders, and caregivers, and family members, of course, who are caregivers. And it provides a model that can be adapted to each state's HCBS waiver program. Every state has its own program, and so it can be a little bit complex to give information about it because each one is different. You would have to look into your state's HCBS and LTSS services. So in order to help with that, we created these videos to kind of help explain it a little bit better. We created one for the state of Colorado, one for South Dakota, and one with like a national overview to kind of help touch on the main points. But again, each state is different. But the idea is to help find services available, help people know how to find the services that are available in each state, guidance on where to begin the application process, information about paid family caregiver options, and our intention, as always, is to provide a culturally sensitive approach to the topic, which is accessing in-home supports for elders. And I think we decided that we'd like to play this video because it's such a important topic.
Are you an elder and having a harder time caring for yourself? Or do you take care of an elder? Do you worry that if you ask for help, someone will try and move you out of your home or put you in a nursing home? What are home and community-based services, or HCBS? And are there any services available for elders where you live? Are there options that let you get help at home while staying in control of the care you get? Do I get HCBS from Indian Health Services, or IHS?
Medicaid is the primary source of care for elders like you to stay healthy, independent, and at home. IHS and Medicare do not provide these services. Medicaid provides health insurance, as does Medicare, or an employer's insurance, and offers many choices for long-term care. One option is HCBS, which is our focus in this video. If you choose HCBS, you will work with a case manager to create a care plan that meets your specific needs. You can choose who comes into your home and when they arrive to help you. Your friends and family might get paid for the care they already give you. Home and community-based services are not only about getting the care you need, but are also more affordable. The cost of receiving services at home is less than the cost of care in a nursing home or assisted living. If you are eligible, the costs are paid by Medicaid. Services vary depending on the state you live in, and reservations or rural areas may have limited healthcare providers. HCBS waivers can connect you to caregivers who live in your area and might even be your friends and family. These caregivers receive pay, training, and support from expert staff such as nurses and certified nurses assistants. Knowing you can get affordable, quality care right at home is reassuring.
What is a waiver?
Waiver is a federal Medicaid term that describes eligibility requirements that are different than regular Medicaid. Every state offers different HCBS options, and each state with a waiver offers different services. Waiver options vary, and so do the names. States all have different names for their programs. Not all states offer HCBS programs as described in this video. For example, Arizona, Rhode Island, and Vermont are a few.
I'd love to hear more. What services are available for waiver participants?
First, you would receive the comprehensive benefits of your state's Medicaid health insurance. Services depend on the state, but many services listed may be covered, such as doctor visits, hospital and emergency services, labs, x-rays, substance abuse treatment, prescription drugs, rehabilitative services, physical, occupational and speech therapy, audiology, hearing aids, home health, private duty nursing, dental, vision, mental health, and chiropractic services, as well as transportation to medical appointments. Services are offered for very low or no copay. Second, a waiver lets you access all the Medicaid insurance benefits in your state and opens the door to additional services you can receive at home. These services are based on your needs and may include home modifications such as ramps or grab bars and home accessibility adaptations, adult day services, assistive devices, chore and homemaker services, emergency response systems, in-home nursing, medical equipment and supplies, meals, participant-directed supports, personal care services, respite care, transportation to medical appointments, and other important places in your community. HCBS waivers let you decide how you receive care at home. You can choose agency-based options like adult day programs, home health, and private duty nursing. Your state may let you select an option where you hire and pay your caregivers, sometimes called participant-directed programs. Many states also offer hybrid options, including in-home agency-provided care and participant-directed caregivers that work together to accommodate your needs. Check with your state to see what options exist for hiring and paying your care team, including friends and family.
Okay. So as you can see, that video has a lot of great information, and we still have a lot to cover, so I think I'll stop the video because we still want to have some time for Q&A. But the link is down there, and you can find that on our website and a couple more. So I encourage you to, look into your state's resources for LTSS, long-term care services and supports. So now I'll pass it back to Marvina to talk a little bit about community education and outreach, the action section.
Thanks, Megan. So our next section is addressing about community education and outreach. It's the action portion of utilizing our resources. We're going to kind of talk a little bit more about the brain health rat cards, our social media toolkit, the river story, and Dementia Friends. The Healthy Brain Rat Card series has been very popular since I've been with IA Squared. We've been getting many requests, and some of our, conference attendants have really been focused on this, and the engagement that creates, opportunities for programs to be able to use these culturally grounded resources in their programming. We've gotten a very positive response for these resources. These were developed with support from the CDC. It's a series about culturally relevant, tailored rat cards to promote brain health and healthy eating in American Indian and Alaska Natives. The series covers, honoring elder hearing and wisdom, sacred sleep for strong and healthy minds, protecting and honoring your head, preserving your wisdom, and a healthy brain series. These are very informative in terms of connecting why prevention plays a big role, strengthening the connections to community traditions, language, and lifestyles. And we can support the brain health and healthy aging across generations. They highlight how traumatic historical traumas, like the loss of land, focused on relocation, and food transitions increased our risk of dementia in these populations. So these are, strategies to be able to promote healthy brain in our tribal communities. Again, these are another series of useful information about, healthy foods, healthy brain. The series covers, general eating focused messages that are practical and culturally relevant. And they have recipes from our tribal communities that have shared some of the recipes on the back. And they're easy to follow. They're easy to be able to communicate if you need to translate them. And they're a quick reference for community members to learn about connecting the connection of eating healthy and your brain health. The tribal, these resources can be a great resource for our tribal senior programs, through their home delivered or congregate meals, and to be able to complement and supplement their nutrition education components in their programming. So they can be, part of the food deliveries that they do, or part of their health promotion programs. We also have a social media toolkit, and this toolkit is really a very useful toolkit to be able to get awareness out about dementia risk reduction and brain health in American Indian Alaska Natives. It gives you an opportunity to be able to make connections with your community, public health providers, and tribal leaders to bring awareness to brain health. And the toolkit provides opportunities to create simple messages in social media. They can also have calendars for health-related awareness dates, several hashtags that could be used in simple messaging on social media platforms. And the message can be copied and pasted into social media platforms, or they can be customized to your communities as well. We also have the river story video. This video really does talk about dementia, and it provides a cultural analog to the topic of dementia, utilizing the connection with the land, watching the river, how we go through life, and how life looks from a tribal community, and being able to engage the conversation of bringing a cultural perspective and knowledge to what changes happen as we age through our lifetime. And this was kind of a story that was adapted. The story was originally written and narrated by Dr. Anton Truer, a professor of Ojibwe, Bemidji State University. And I know Megan tells a better story about this video than I do, so I'm going to let her finish up here.
Thanks, Barbina. So, as she said, this was originally written by Anton Wogash Truer, who's a professor of Ojibwe, and it's narrated by Dave, who Bill talked about in the beginning. And so it's important to remember that dementia affects each person differently. However, this analogy of a river in a long winter storm helps explain the experience of progressive dementia. And storytelling holds a special place in many Native communities, serving as a way to share knowledge, preserve traditions, and pass values from one generation to the next. When we talk about aging and dementia, storytelling takes on an even deeper meaning. Through the voices of our elders, we gain insights into their lived experience, filled with lessons of resilience and the importance of family and the strength of community care. These stories allow us to bridge the gap between traditional ways of knowing and modern concepts of health. So the traditional ways of knowing, like the river and the seasons that you're about to see, and modern concepts of health, like dementia, which helps make complex topics like dementia more understandable and relevant in a culturally meaningful way. Storytelling also strengthens the connections between generations, inviting younger members of our communities to engage with and learn from elders. So this intergenerational sharing is crucial for raising awareness about dementia and reducing the stigma that surround it. So let's watch the video, and then, because this is really beautiful.
For every human being, life is like a river. The constant flow of water represents our daily experiences, from routine and familiar to those that take us by surprise. If we're lucky enough to live a long life, we'll experience the river in each of the 4 seasons: spring, summer, fall, and winter. Spring is early childhood, when the river is new to us and we're just learning about all the fish, birds, and animals that connect with it. Summer is our experience from childhood to adulthood, when we transition from relying on others to navigating the water and harvesting for ourselves. Fall is adulthood, when we know the river and its resources and dangers well enough to provide for others, raise children, and chart our own course in the world. Winter is elderhood, when we've acquired the deepest knowledge and wisdom, but also start to experience changes from the aging of our bodies. Dementia is like navigating a river freezing in a long winter storm or even a blizzard. Storms can come in any season, although they're most common and most severe in winter. The wind and snow make it harder to see and hear the water. Everyday life, the natural flow of the water, becomes harder to navigate. Thinking activities that used to be easy, like planning a fishing trip, buying bait, planning meals for the trip, and reaching out to others to join the activity, become increasingly difficult. However, even at the start of a winter storm, emotional experiences and feelings remain strong. For example, the love of fishing, the memory of the sunlight bouncing off the rippling current, and the joy of company. The longer a person lives with dementia, the thicker the ice on the river can become. The everyday flow of experiences beneath the surface is more difficult to reach and navigate without help. Eventually, even deep and lifelong emotional and spiritual connections are harder to access through the thickening ice. This story of a river in a long winter storm helps explain the experience of dementia. Facts, recent memories, and complex thinking become harder to reach in the thickening ice, while deeper memories and emotions continue to flow under the surface.
So as we can see, stories provide a gentle way to open conversations about aging and cognitive changes, encouraging communities to approach these topics with compassion and a shared sense of responsibility. So by embracing the power of storytelling, which I encourage you to do in your work, tribal communities can blend cultural wisdom with effective strategies to address dementia, ensuring that solutions are respectful, meaningful, and rooted in tradition. And that can be also found on our website as well. And we also use that video in our Dementia Friends program. So if you've heard of Dementia Friends, it's a worldwide program, and I Squared had the opportunity to adapt the Dementia Friends programs to be for tribal communities. So we serve as the national sub-licensee for the Dementia-Friendly Tribal Communities program. And we adapted it and piloted it to reflect Indigenous values, traditions, and perspectives on aging and caregiving. So every quarter, we hold Dementia Friends information sessions where you learn about being a dementia friend. And then once you do that, you can go on to become a Dementia Friends champion and get that certification and training so that you can deliver the Dementia Friends program in your community. So it's kind of a train the trainer program, and that expands the reach through community leaders, caregivers, health professionals, and tribal partners. And we actually partner with the Dementia-Friendly America Nevada Dementia Engagement Education and Research DEAR program at the University of Nevada, Reno. And our dear Casey, who's leading this today, he helps us deliver the Dementia Friends for American Indian and Alaska Natives. He delivers that program in collaboration with us. So we're really grateful to him for all his expertise in doing that and helping us capacitate. I don't know how many so far, but we've had probably hundreds of people attend and become Dementia Friends and Dementia champions. So Dementia Friends champions. So if you're interested in that, that can be found on our website, or you can reach out directly to us for the links to do that quarterly. We have a training. Now I'll pass it back to, I think, Bill, you're going to take this part, right?
I am. Thank you very much, Megan and Marvina, and there's more to come. I know we're starting to get pressed for time, so I'm going to be very brief here. At the outset, I said that, we also like to engage in policy-related work whenever we can, and we're not often funded to do that. But here's some examples of some policy things that we've done that we think are really useful. We produced a report, our tribal law and policy on Alzheimer's disease and related dementia issues. And what we did with this report, now probably dated, and we did this with the tremendous help of our dear friend and colleague, Mike Splain, but we took a look at every known Alzheimer's state plan that we could get our hands on, or national plans, even internationally, New Zealand, for example, Australia, Canada. And we wanted to find language that was that really addressed serving Indigenous people. And the idea was that if a state had not yet created an Alzheimer's state plan, or they were going to update their state plan, we wanted to give them examples of how states and governments are addressing dementia for Indigenous people. The truth is, we didn't find a whole lot. We found more in the international plans than state plans, but we did find some. And so it's really a guide for, we think, for any state or community or country, quite frankly, that wants to have an Alzheimer's disease or dementia plan or policy, to learn from those that have actually addressed Indigenous people in their plans. So that was the first one. The next one that we'll talk about very quickly, if we could go to the next slide, is our tribal resolution toolkit. As anybody who works in Indian country or is part of a tribe knows, that generally, as a rule, very little is going to happen from a policy standpoint without the approval of tribal leadership. And very often that means putting a resolution before the tribal council or the tribal board or the tribal governor to get their endorsement of whatever initiative that's going to take place, particularly if it involves money of some kind or another. So knowing that tribal resolutions are really essential to making things happen in tribal communities, we produce this toolkit around dementia actions. So the idea is that if you are a tribal member or working with a tribal community and you wanted the tribe, for example, to develop its own dementia plan for the tribe, or to initiate a new program, or to embrace dementia friends, for example, it probably will require approval by leadership of a resolution in the form of a resolution. So we provided a template approach to a resolution. Here's how a typical one looks. Here's suggested language that you can put just to make it easier for individuals who want to promote an initiative within a tribal community to be able to, without having to spend inordinate amounts of time trying to think of what can I say in my resolution. We wanted to help jumpstart that effort so they could get it before their leadership as quickly as possible. Quite honestly, this would work for any initiative, whether it's elder justice or caregiving, but by just using different language. So we think it's a very, very flexible model or approach. But this one is particularly developed and modeled for dementia-related work or efforts or initiatives. And then one final slide for me. This is a follow-up to that earlier policy piece that I showed you, where we took language from existing state Alzheimer's plans or international plans on aging. Here, what we did is we went through and extracted from every plan that we could get our hands on, Alzheimer's disease and related dementia plans, to look for any language, even if it did not speak about American Indians or Alaska Natives, language that we thought was inclusive, that it was language that would communicate inclusivity towards other populations, other cultures. And so we extracted every bit we could find in contemporary plans and put it all into this document, again, as an idea, so that if somebody wants to create a plan for their tribe, for their state, for their city, whatever, that if they wanted it to be inclusive, we gave them language to make that doable. These are both projects that I hope over time we can return to and update them. Best of all would be if there was no longer a need for these kinds of tools, that all plans would be inclusive with the appropriate language. Although I must say, I don't think that's the trend at the moment, but I wish that it would be. So I think I'm done here.
Thank you, Bill. Marvina?
The last section is talking about cultural responsiveness and best practices. You can go to the next slide, Ian. We created a one-page document to be able to provide some, best practices with engaging Indigenous communities. This document provides an overview that centers on, creating respectful engagement and honoring, tribal sovereignty, government-to-government relationships, and, emphasizing on trust, cultural respect to working with Indigenous leadership. It highlights, the importance of having clear communication, inclusion, and accountability. The goal for creating this document was to help strengthen community priorities and be able to foster long-term partnerships so that, we can actually have some progress in addressing some of our, health disparities in our tribal community, not just dementia, but all other related diseases that, affect our tribal communities. So it's a one pager that really does help, really help build that relationship. It guides, respectful and grounded community collaboration, and really be going back to, focusing on trust and making sure that, the engagement, gives an opportunity to establish a shared decision making in all programming at a tribal level. And our last slide is just kind of like a overview of all of the publications that we have on our website. And, IA Squared's commitment to be able to develop culturally responsive resources. For me personally, this has really been an eye-opener for me, and it shows progress. And I was just sharing earlier that as I was growing up, I didn't see anyone that looked like me on any publications. So, it is amazing to see that we've kind of made some strides and progress that where I can actually see and recognize my own people on some of these publications to bring awareness and tie them back to our communities that, diseases and some of the health disparities in our community do affect us as tribal members. So it's amazing that, we see this kind of work now being laid out through IA Squared's effort and back into our community so that we can continue to bring awareness to our needs and, be able to educate our people to be able to make some lifestyle changes to be healthier. So in closing, we started off in the beginning, to be able to have some ideas, to be able to kind of have some plans on how to utilize our resources. And, at the end of our presentation, we would appreciate any feedback on, how will these resources be able to support your community priorities? What opportunities, could be used to build out what you're already doing in your communities? And who can you invite to be able to be part of your work and your efforts in your tribal communities? And what is the one meaningful action that you can use to promote brain health and dementia awareness? So our goal is really to be able to collaborate, provide cultural knowledge and community leadership, and we can create a healthy futures for our elders and community members for generations to come. And this is our last slide. All of our website, our QR code is right there to our website. You can, download our resources for free. You can subscribe through our website as well to be able to be part of the emails, blogs, and social media, so you can get updates on some of the new programs and resources that we develop. So we do a lot of utilize social media as our platform to be able to, provide our resources and new information that comes out as well. And this is our contact information if you have questions, or you'd like more information about some of the resources that we've shared. We have our admin email there. We have our Bill's email, myself and Megan as well listed there. So feel free to reach out and email us if you have questions, or we're always open to getting and having a conversation on how to implement some of our programs in your program as well.
So thank you guys for attending. And we're happy to answer some questions right now in the remaining time.
Yeah, thank you so much, Megan and Marvina and Bill. Wow, I have some closing thoughts, but first, I'm really excited to hear all the questions that I'm sure our participants have. I see, and I will go ahead and moderate those because I see them coming in already. I see Yvonne's hand first.
Thank you, Casey, and thank you. Great presentation. And how you've been around for many years, like 24 years. So how do you get your funding to stay? Because it's amazing all the things that you're providing. That's my question.
Great question.
Thanks.
Thank you so much, Yvonne. We are heavily dependent, unfortunately, on federal funding. And so we have currently funding from 3 different federal agencies, the Centers for Disease Control and Prevention for our brain health work, the Administration for Community Living for our elder justice work, and the Department of Justice for our wandering work that Megan talked about. We've been able to also have some smaller contracts with tribes themselves, which we are always thrilled to get. For example, we just completed, or no, we didn't just complete, we're in the middle of doing a elder justice project for the Kodiak Area Native Association up in Kodiak, Alaska. We've just finished some work with the Intertribal Council of Arizona, but we are largely dependent though on those federal dollars, and they are vulnerable right now, to say the least. So we hope to be able to continue this work by hook or crook.
Thanks, Bill.
You bet. Thank you, Yvonne. Yeah.
I know we must have some other questions, so please feel free, if anything, any burning questions, come off mute. You can speak up or feel free to put it in the chat as well. Sue, I saw you maybe started something in the chat. Is there a question that you had?
Well, I didn't have a question, but I wanted to say how impressive their presentation is, the information that they're sharing, the resources. I hope you get your funding because I think you've done a wonderful, wonderful job. Thank you very much and good luck to you.
Thank you, Sue.
Any other questions or thoughts from anyone? Again, feel free to come off mute.
Bill, did you want to add something about the LTSS?
Oh, thank you, Megan. Thank you for that. When we showed you our LTSS video, that was a very broad national overview. It's not the dilemma with Medicaid is very, very state specific, particularly when it comes to long-term services and supports through home and community-based service waiver programs. They're unique to each state. And so to do justice to that issue, we really need to address it not in a national overview. That's helpful as kind of broad guidance, but the nuances, the peculiarities of any state are really important in this context. So we partnered with a little bit of federal funding from ACL. We partnered with the National Indian Council on Aging with just enough money to produce 3 videos. The one that we showed you, and then we did one specifically for Colorado and one specifically for South Dakota. And the reason we chose those states is because they have significant indigenous populations, but also our team that was working on it happened to know a lot about Medicaid in those 2 states. but we believe that that at least all those states that have indigenous populations, which is most states, they should develop or have us develop, ideally, but they should develop a similar video that explains HCBS under Medicaid for Native people in that state. But it really, to have its greatest impact, it needs to be tailored to the state.
Thanks, Bill. I saw Yvonne's hand up again.
Yes, thank you, Casey. One more comment and question for Bill. I happen to have dementia, Huntington's disease, which is rare, like many dementias. So the point is that I want to make is HDSA, the Huntington's Disease Society of America, is also trying to reach more cultural groups. Right now, it's mostly Caucasian, but they're looking. I haven't heard about them trying to find people who have the heritage that IA2 has. So just know that you might even want to partner with HDSA. It's a 501c3 and nonprofit. So I just wanted to let you know I just went to convention and they were talking about this, but not specific. IA2 was not mentioned.
Thank you very much,
Okay.
Yvonne. That is a wonderful suggestion, and
Okay.
I think it's one we absolutely should follow up on. I like that. We had a small project a few years ago with a national association focused on migraine, and which I had not heard of before, but they wanted us to help them take their messaging and tailor it to indigenous communities or peoples because of data that suggested disproportionate impact of that condition on indigenous people with migraines. So yeah, there's opportunity for us to partner with folks, and so I am grateful to you for that. Thank you.
Okay. And thank you, Bill.
And best of luck to you.
Thank you.
I just got an email this week that one of my best friends was just diagnosed with dementia, and it's always such a difficult thing to deal with.
Yes.
He is an amazing, resilient, energetic guy, and he's gonna do everything as possible to deal with it as effectively as possible.
Well, lucky for him that he has you to vouch for him. And Casey runs the is one of the ones who runs our deer program, and I'm part of a lot of those calls. So, and have even gotten to help with a book and just all kinds of things. So they give me hope. I'm mid-stage, but and yes, I'm not forgetful of what's coming, but I thrive on the hope that there will be a cure for all of us and that we can have quality lives.
Well, I wish that for you. You clearly have an incredible spirit.
Thank you, Bill.
Thanks, Yvonne. And Aruna also mentioned the Parkinson's Foundation in the chat. That's a good suggestion too. Thank you, Aruna.
Well, I will take this opportunity again. Megan, Marvina, Bill, thank you so much for being here and sharing these resources and this information with us. As I was mentioning to you before our call today, despite the years of partnership between the DEAR program and Dementia-Friendly Nevada and IA Squared, I feel that every time we talk, I learn about something new that you are doing. And it is just such a tremendous I personally am so grateful for the partnership that we have had. I mean, for what I've been able to learn from you, because, I think as someone, maybe I think Vernon pointed out in the chat, with the river video is a great example. When we design with inclusivity in mind, we create resources that are better for everyone.
Absolutely.
And taking part in the adaptation of Dementia Friends, I don't know if IA Squared knows, but a lot of the specific cultural adaptations that we made, what we found, we actually went back to Dementia-Friendly Nevada and considered those same adaptations just in the general context here in Nevada and said, Well, actually, we like these changes broadly. And so we worked a lot of those adaptations into our general version of Dementia Friends that we use in Nevada. And so again, like I think that when we bring more minds, more diversity, more lived experience to the table, we end up with better products and better approaches and better programs. And IA squared is is a premier example of what it means to really lead with collaboration, right? Everything that you have shared, everything that you develop, everything that you do, you bring stakeholders to the table not as an afterthought, not as a box to check, but as an integral component of your process from the very beginning. And you listen, and just like we do at the DEAR program, you are so committed to co-leadership, not just listening, but co-leadership. And I truly respect that. You are kindred spirits, and I would encourage anyone go and peruse the IA Squared website. Go back time and time again because my goodness, despite having a small team, like I said, every time we talk, there is something new. There is so much work, great work happening at IA Squared. So every time you visit the website, I know you'll see something new. So go back again, put a little reminder on your calendar to go visit the IA Squared website once a month and check out what new they have to offer. But thank you to the three of you for your leadership, for your partnership, for all that you do, for being the people that you are.